We call it lactogenesis. This natural swelling generally lasts for a day. Sometimes complications can arise. Breasts can become painful.
Cancer. Radiation therapy uses high-energy X-rays or other types of radiation to kill the cancer cells or to keep them from growing. Internal radiation therapy can be used to treat the cancer from the inside of the body with needles, wires, or catheters. Chemotherapy is a treatment that uses drugs to stop the growth of cancer cells by either killing them or inhibiting their cell division. Once the drugs enter the bloodstream, they can travel and reach cancer cells throughout the body. Some types of breast cancers need hormones in order to grow and spread. Hormone therapy works by blocking the cancer cells from receiving the natural hormones that they need. Tests can show if your breast tumor has these receptors and if it is a good treatment option.
Part of the Gerson therapy is doing a lot of fresh pressed carrot juice. So carrot juice through individual case studies has been shown to absolutely beat and fight cancer. So if anything is sweet on the list, the berries and carrots are the only things, and they're mildly sweet, low levels of sugar. But again, carrots are great for naturally fighting cancer. And by the way, I know that my list here is, I set up my phone here to look towards me today because I didn't have anyone to film me. So I doing this at myself in my house. But again, carrots, if you can read backwards here. And I will post this list at the end here as well. So now we're going to get into the last three, and then I'm about to jump into the top herbs and supplements and essential oils for fighting cancer in just a minute. But hey, do me a favor. Right now, there are millions and millions of people that are going to be that are diagnosed with cancer and don't know there is another way. Help me spread the message right now. Take a minute, punch that share button, click that love button. Help me share this. People need to know the truth that food is medicine. My mom's life was saved because of some of the information I'm sharing today about the best foods and supplements and essential oils to fight cancer. Hey, thanks so much everybody who's on mission with me right now. All right, let's talk about the last three here. Cruciferous vegetables, okay? Now, cruciferous vegetables actually contain compounds like indole-3 carbinol, okay? And this compound found in cruciferous vegetables has actually been shown to detoxify your body from phytoestrogens. Now, this is specifically important with estrogen-based breast cancer. If you know someone that has breast cancer that's hormone-related, they need to be eating cruciferous vegetables. Now, I want to say this. In my opinion, cruciferous vegetables should not be consumed raw. They should be consumed only cooked, okay? So in consuming cruciferous vegetables, they should be well cooked. And again, not soggy, but they should be cooked. Broccoli, cauliflower, cabbage, okay, Brussels sprouts. Very, very powerful at fighting cancer, but they're best cooked. Did you know some foods, are better raw and some foods are better cooked? And it depends on what you have going on in your body. When you cook, certain nutrients become more absorbable. But also, when they're cooked, sometimes they lose some enzymes. So it just really depends. But again, cruciferous vegetables, in my opinion, should be cooked. But they are really powerful. Again, especially if somebody has an estrogen-based breast cancer, for breast cancer, ovarian cancer, uterine cancer, cruciferous vegetables that are cooked can be very beneficial. Number 9. Here we go. Avocado and coconut. Now, again, I mentioned this earlier. One of the most popular diets today for fighting cancer is called the ketogenic diet. Now, the ketogenic diet is where you completely get rid of almost all sugar in the diet and you consume mostly fat.
Buy in the store or offline if you don't feel comfortable buying them in a store. And another product that I really enjoy using for my patients is coconut oil. It's all natural, it's very comfortable, and you can also use it for scar mobilizations and things like that.
And things like pain, what would you recommend for something if there's pain during intercourse?
Pain during intercourse. Well, that's a little bit of a deeper question because we have to figure out why the pain is there in the first place. The first thing that I would definitely recommend is starting off with a little bit more of a partner massage so that you can really work on relaxing the muscles, kind of getting your body ready for that sexual intercourse, because a lot of times what will happen is people will start to tense up because they may anticipate some of that discomfort. So being able to get yourself down and relaxed into a comfortable position is where I would generally start. Foreplay is a great thing. Try to get yourself as lubricated and involved into the act before you actually go forward. And if it continues to be a problem, I would recommend either going to your gynecologist, asking them and seeing if there's anything that they can do, maybe a topical lidocaine or some sort of medication, and then following up with a physical therapist as well.
You've mentioned some of the physical issues, but what about some of the more psychosocial or psychological issues such as body image? Are those concerns, and what do you recommend that patients do about that?
So this is a great question, Alyssa, because a lot of times as you're starting to go through that survival phase of treatment, you become a medical body. Your body is about getting the cancer out and fixing that. And what we see is as we start to progress towards the thriving and after treatment, we need to get you back to your physical body and your sexual body. And this can sometimes be difficult, especially if a part of you has now been taken away. It's really important to also find some new areas that may be more sensitive, since the areas that were so sensitive may no longer be. So I would really recommend a lot more self-exploration. You know, a lot of times my patients say that the scars tend to be a little bit more sensitive. So explore some new areas and see where those sensitive areas now are.
What can partners do during this time to be supportive?
Well, first and foremost, I absolutely love when my patients have their partners come in with them. It is so wonderful to see. It's really supportive, and I know it means a lot to the patient too. They may not actually say anything about it, but it really does help them a lot. And I would recommend that communication be really key. Just realize that your partner has gone through a life-changing event, and just being able to understand that. Don't be afraid of them. Don't pull yourself away from them. This is when they really need you to be there.
The staging of breast cancer refers to the extent of the disease. The cancer stage is based on several factors, including the size of the tumor, if any lymph nodes are involved, if the cancer is invasive or non-invasive, and if the cancer has spread to areas beyond the breast. Stage 0 is considered a non-invasive breast cancer. In this stage, there is no evidence that the cancer cells have spread into neighboring breast tissue beyond the duct or lobule. Stage 1 is considered an early stage of invasive breast cancer. When measured, the tumor is no more than 2 centimeters in diameter, and there is no evidence that the cancer cells have spread beyond the breast. Stage 2 is divided into subcategories of 2A and 2B. Stage 2A is invasive breast cancer, where the tumor is either a maximum of 2 centimeters in diameter and has spread to the lymph nodes under the arm, or the tumor is between 2 and 5 centimeters in diameter but has not spread to any lymph nodes. Stage 2B is a little different in that the tumor is either between 2 and 5 centimeters and has spread to underarm lymph nodes, or the tumor is larger than 5 centimeters but has not spread to the underarm lymph nodes. Stage 3 is considered a locally advanced cancer, and it is also divided into subcategories of 3A, 3B, and 3C. There are 2 main scenarios that can occur with stage 3A breast cancer. One, where the tumor is no larger than 5 centimeters in diameter, but it has spread to underarm lymph nodes that are growing into each other, forming clumps. The cancer may also have spread to the lymph nodes near the breastbone. The second scenario for stage 3A is very similar, with the exception that the tumor is larger than 5 centimeters in diameter and that the underarm lymph nodes are not adhered to one another or other tissues. Unlike the other stages, in stage 3B, the tumor may be any size and has spread into the skin of the breast or chest wall. This stage may also include lumps in the